Okay, now we're going to shift over to Stacey Whiteman, and Stacey is one of our patient family advisors at Beth Israel, and Stacey has graciously allowed us to look at a mental health note of hers that she was willing to share. We've de-identified some of the information in there, but maybe we could just go through that real quickly. So, so we have down here, this is the note overall. You can see this is just, Stacy wanted to have you see what a note looks like, and it's different. A lot of folks think it's the same as a visit summary, and it's not. This is a note, and I've just kind of highlighted some words in red that basically kind of go through a little bit about this is from the social work therapist, and then there's the um, a little bit about the problems and the issues being worked on. Stacy is someone who was diagnosed a few years ago with MS. She'll be talking about that, and so this goes through a little of what they're working on, and then gets into the mental status and the clinical assessment, and then the diagnosis. So we pulled some of that again off, but it would be the typical ICD coding, and then the recommendations going forward in that way. And Stacy, do you want to open up for yourself?
Sure. Um, my love affair with open notes began right after my diagnosis with progressive MS. That diagnosis came out of nowhere. I used to be a high functioning executive assistant, and then one day it all went away. I could no longer function. My life became very chaotic. Um, my brain was a million different pieces. I couldn't understand my illness because I was so stressed out because my brain was a mess. I was neuropsych tested, and it came out of that I needed to see a therapist in order for me to manage my care. And in order for me to manage my care, I needed to become less stressed and less full of anxiety. Now, I also had a history of depression. So I met my therapist, and the first thing she said to me was, "How are you going to feel about our therapy sessions going into open notes?" And I said, "I'm going to love it." And she said, "Really? Why?" And I said, "Because I'm not going to remember anything that comes out of this session. I have a hard time processing things now. My cognitive functioning decreased so rapidly that I couldn't make heads or tails out of anything. My kids went to go live with their dad. I couldn't function on a daily basis. Tasks became unattainable to me. So during my sessions with my therapist, um, we talked about a lot of different things, and she had a knack of putting my uh, different words into making sense for me. And then I would go home, and I would read my open notes at my leisure. I could understand them better because I would continue to reread them. And we always had an assessment. We always had a follow up. I always had homework. I always had things that I needed to do in managing my care until the next appointment. And that was a huge tool for me. And eventually, over time, I could understand my illness better. I had no idea what MS meant. I had no idea what was out there. I didn't want to know what was out there until I understood my illness better. Um, I didn't know if parts of it was my depression or if parts of it was part of my MS, and my therapist had a way of helping me decipher that. I also have a psychopharmacologist who regulates my medicine, and Open Notes allowed me to be able to take my sessions and PDF them and send them to him. And he would regulate my medicine based on my sessions. If I was experiencing a lot of anxiety, then my therapist would say, "You need to get this over to him so that he could regulate my medicine." Um, Not everything was about my MS. Not every symptom was about my MS. And my therapist would have a great way of helping me decipher that. Because it was an invisible illness, and I'm sure all of you are looking at me saying she's articulate, she looks good, there's no way she has MS. But what people don't realize is I'm fighting a battle inside myself. And I hide it well, I hid it well from my kids. And I would go into my sessions and say, "This is so frustrating. I'm in so much pain and people don't understand it. And how do I cope with this? How do I get past it? How do I make people understand my illness without having them feel bad for me? I don't want people to feel sorry for me. I just want them to understand that I can't process things. I want people to understand that sometimes I just don't feel like going with my family today, without them being upset with me. And so there were a lot of different dynamics associated with having progressive MS. And I always said that I'm the person whose life changed in a split second. I went from being a high functioning executive assistant to being somebody that had those skills no longer existed in me. And therapy continues my therapy sessions. Every week I read my therapy notes. Every week I find something different in my therapy notes. And my open notes are an extension of who I was in my previous life. And I rely on them very heavily to manage my care. And, I have an MS doctor. He has open notes, but he is just that. He's my MS doctor. He tells me when to go for my infusions. I do a checkup. I read my notes. Okay, fine. My therapy sessions, I relive my appointment all the time, and it just keeps my therapy going. And when I was preparing for this webinar, I was looking back the past 4 or 5 years on how far I've come with my therapy and understanding my care and managing my care better. And I have really come a long way in managing my care. I'm not stressed. I can read blogs now. I can understand my illness. I'm not afraid to see what's out there relating to my MS, whereas at first I was, because I wasn't prepared for it. And open notes has become a huge part of my therapy and a huge part in managing my progressive MS. And without it, I have no idea where I would have been today. So,
Great. Thank you very much, Stacey, for sharing your experience and your note. You've been an amazingly courageous person throughout this journey.